Hello out there in television land, and welcome to yet another edition of It's Your Health. The fastest 30 minutes out there in television land, right, sweetheart?
Right, sweetheart.
Boy, I love her. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Make sure you check with your healthcare provider before doing anything, and I mean anything that we talk about here on It's Your Health.
That's for sure.
We'll be right back. Welcome to the first segment of It's Your Health. Philip Benyo with my bride-in-law, bringing you the latest and greatest in healthcare information. Happy holidays out there, too.
Merry Christmas and Happy New Year.
Right. Any New Year's resolutions?
No, bearing with you is about as good a resolution as I can get.
Well, when you're perfect, you don't have to make any. You're right. So, speaking of perfection,
You're my New Year's resolution.
Let's move right along.
Okay, I decided that our first headline should be one that I'm very familiar with. It's about caffeine and menopause.
Not cooking and cleaning, by the way. Caffeine and menopause. Go ahead.
Bearing with him is my New Year's resolution. Anyway, is there a link between caffeine consumption and menopause symptoms? There does appear to be a link, and namely, the link is hot flashes.
Right. Well, it doesn't make too much of a stretch to put that together. Caffeine, of course, can raise your pulse, your blood pressure, as can hot flashes. It can vasodilate, if you will, and make you have a hot flash. So I think if you're out there suffering from those, you might want to wind down your caffeine intake. Caffeine actually is a drug. There's a syndrome called caffeinism, by which too much caffeine is in your bloodstream, and we can measure that, by the way. In the olden days, we used to do that. So just dial it down, see what happens.
Dial it down. You get hot flashes anyway, trust me. Next headline, plugged ears. What is the remedy? I'm just getting over a cold and my ears feel plugged. What causes this, and is there a remedy?
Well, it depends what's causing it. Often in our line of work, it could be earwax. And so we see patients, particularly if they have hearing aids, they keep on shoving the wax in more. Removing the earwax may improve your hearing right then and there. Following a cold, you probably have some eustachian tube dysfunction, which means that the eardrum drains down into the sinuses via a very thin spaghetti tube. And if that gets blocked, the fluid will build up and you'll feel like you're underwater. So maybe a decongestant or blowing your nose, things along those lines will help relieve that. I think if you have continued issues, you should really see an ear, nose, and throat doctor, because there are serious conditions that will manifest themselves by hearing loss.
There was someone, I can't remember who it was just talking to me about flying somewhere, and they couldn't get their ears to pop after they were flying, and they tried chewing gum and all that usual kind of stuff, and none of that worked. This is an interesting one because I wasn't aware of it, about Vicks VapoRub. When I was a child, my mother put a little Vicks on my chest and under my nose to help me breathe. Does this really work? Vicks VapoRub doesn't relieve nasal congestion. The strong menthol odor of VapoRub tricks your brain, so you feel like you're breathing through an unclogged nose. How about that?
Yeah, I'm not so sure I would put something like that, especially on a child. You're asking for trouble. Those vapors can get into the lungs. Children can aspirate. So I think that not to knock that particular drug, I probably would not recommend using it.
They do recommend that the child should be at least 2 years old and that you only use it on the neck and chest. And as my husband so clearly stated, it's better not to use it at all.
Get some Boilo, maybe.
Boilo for a baby. Well, this is a serious topic that people have to deal with. Urinary incontinence, the loss of bladder control, is a common and often embarrassing problem. The severity ranges from occasionally leaking urine when you cough or sneeze to having an urge to urinate that's so sudden and strong you don't get to a toilet in time. What are some symptoms?
Well, we see this a fair amount in women more than men. And as you mentioned, there could be what's called stress incontinence. When you cough or sneeze, you can push out some urine. There's an urge incontinence, which means you can't even make it to the bathroom. You have to urgently go. Bladder infections, kidney stones, polyps, growths, or tumors can all do that kind of thing. And so what you really need to do is to bring it to the attention of your healthcare provider. Most women don't like to, and men for that matter, don't like to admit that they're having incontinence issues. But we don't read minds, so bring it to our attention and we'll kind of take it to the next level. You shouldn't be out there suffering with this.
And some of the things that might affect it are alcohol and caffeine again, and even artificial sweeteners and chocolate.
Yep.
Who would think that?
Right. We once saw a person who had urinary incontinence and they had simply uncontrolled diabetes. And so it can be a symptom of something other than just your bladder.
Okay. Oh, this is a good one, especially for right now. What was it, 0 degrees when you got up this morning?
Yes, it was 0 degrees, and when you got up it was what, 20 degrees?
No, it was still in the single digits. Very funny. This has to do with frostbite. First aid for frostbite. It's when skin and underlying tissues freeze after being exposed to very cold temperatures. The areas most likely to be affected are the fingers, toes, ears, cheeks, and chin. Early signs of frostbite are a numb, pale patch of skin or skin that feels hard or looks waxy.
Right, and it doesn't take much, particularly when you're throwing a wind chill. If you're out at a ball game or something like that, keep in mind that you don't want to rapidly rewarm the skin. Frostbite is a medical emergency. You might want to just get to the emergency room so you don't lose a digit or so. Don't use alcohol to rewarm, and obviously don't smoke. That tends to cut down on circulation in and of itself. Prevention here is the key.
That's a good thing. You should wear a hat and gloves. Did you wear a hat and gloves today?
No, sweetheart, I did not.
Now, you could get frostbite.
I know, but I have you to keep me warm.
Oh, listen to this. And you should also drink warm liquids like tea or coffee.
We're back to Boilo.
Or Boilo.
Boilo. Well, listen, we told you it's the fastest half hour. We're going to be right back after this brief commercial message. You're watching It's Your Health, your leader in healthcare information. Right, dear?
Whatever you say, dear.
Oh, you gotta love her.
We're back.
Oh, you're bringing us in?
I just did.
Oh, okay. I was here getting frostbite, so.
No, not in here. You won't get frostbite. Not to worry.
Thank you.
You're welcome. Well, we can do headlines instead.
Let's move right along.
Okay. Skipping breakfast confers an increased risk of cardiovascular event. The omission of breakfast could potentially be a marker of unhealthy dietary and lifestyle behavior and is associated with increased risk of non-coronary and generalized atherosclerosis.
Yeah.
That's a hard one to say.
That's kind of interesting. If you skip breakfast, you generally have a bad lifestyle, and it could lead to cardiovascular risks. And I'm recalling an old ditty out there that said, for breakfast you should eat like a king, a prince for lunch, and a pauper for supper. And we do the opposite.
Did your mother say that?
Maybe. If you recall, when we were over in Ireland, that's exactly what happened. You would have these tremendous breakfasts, light lunch, and even a lighter supper. So we do the opposite in America, and I think that leads to more issues. So.
Yeah, I skip breakfast. I'm not a breakfast eater.
Well, when you get up at noon, it's pretty hard to eat breakfast, sweetheart, so it's pretty hard to do that.
Skipping the breakfast has, people were more likely to have a high intake of red and processed meat, sugar-sweetened beverages, alcohol, lower consumption of fruit and vegetables and whole grains, and lower adherence to the Mediterranean diet. So all of that goes into
Skipping breakfast.
skipping breakfast.
Good point. I think that's well taken.
Okay. This is one that I hope I don't get. I hate this. A toothache. What's the first aid for toothache? Tooth decay is the primary cause of toothaches for most children and adults. Bacteria that live in your mouth thrive on the sugars and starches in the food you eat. These bacteria form a sticky plaque that clings to the surface of your teeth. Yuck.
Yeah, well, we see toothaches obviously when it's the holiday or the weekend when your dentist isn't available. Sometimes it could be to an injury if you're eating something like a nut or something like that.
Oh, I've done that.
And what we would recommend is first try brushing your teeth and flossing. You might be able to pull out some of the aggregate that's in there aggravating the tooth. Sometimes it can lead to an abscess, which is something that you should be on an antibiotic for, and ultimately get to see your dentist. And I think that's something that we don't emphasize enough as a society is dental health. Dental health is so crucial and so far forgotten. And without question, if you have bad dental health, you're going to have bad general health.
And then you have gum disease.
Right.
And that leads to other issues.
Sure, you can't eat, you lose weight, and on and on and on. So if I was to provide you a New Year's resolution, go see your dentist.
That's a good one.
That is a good
I
one.
have a dental appointment in a week.
Oh, no kidding. That's
Yeah.
your New Year's resolution.
I guess so. I didn't realize it when I made the appointment long ago. New headline, Ginkgo biloba. Can it prevent memory loss? The extract derived from the leaves of the ginkgo biloba tree is often touted as a memory aid. Is this true?
Probably not. And I think it falls under that category of trying to find a pill for every ill.
Did you just make that up?
No, I think my mother told me that one too.
Okay.
The issue is, as we age, you may have some mild memory impairment, and that's kind of normal, if you will. And where I put my car keys, I might forget. What really gets us into trouble is if you look at the car keys and say, "What is this for?" That's obviously not memory impairment.
That's a good way to compare.
That's like a cognitive impairment, which is more what people are worried about when they lose their memory. They say, are they getting Alzheimer's? Probably not, and I'm not so sure these medicines. I think social activity, socialization is key, and doing mind exercises, crossword puzzles, and those kind of things are very useful. And the other thing I have to mention is medications often have tremendous central nervous system side effects. And in our line of work, getting rid of some pills will actually improve a person's memory.
Well, I've learned to improve my memory with keys is always put them in the same spot. Never change the spot where I put them. Then I always find them.
That's true. That's good advice. Another New Year's resolution. Put your keys in the same spot.
Yep. Okay, here's a good question. Can exercise prevent knee osteoarthritis?
That is a good question, and as our baby boomers are aging, we are seeing knee replacement after knee replacement. Everybody's knees are wearing out.
And hips.
Presumably from lack of activity and increased weight. And that's a 1-2 punch for osteoarthritis, particularly of the knees and the weight-bearing joints, the lack of activity and the weight gain. So yes, exercise can help to forestall you getting knee issues and knee replacements, but you got to do it now. Another New Year's resolution.
Wow, he's just full of them, isn't he?
You've said that before, but go
I
ahead.
have, but not exactly that way. Okay, I have a question for you. It's a trick question. how many puffs of a cigarette is too many?
Yeah, that's interesting, because we have patients who are saying they're cutting down and they just light up and take a few puffs and then put it out. I guess the correct answer is one puff too many. Is that correct?
That's exactly correct. Smokers and social smokers, only 10% had normal blood pressure, where non-smokers, 80% had normal blood pressure. And that's something that's people don't think about, but that's important, is what your blood pressure is.
Yes, no doubt. And there goes yet another New Year's resolution. You got to curtail the tobacco use. I mean, that's probably the biggest thing we do to ourselves to shoot ourselves in the foot. It just is an unbelievable, nasty habit that has tremendous health care consequences, especially in our youth. That's just no reason for it.
What about those e-cigarettes, those vapo things?
There's no bargain. You're still inhaling chemicals that you're not sure what they're doing and what they are. So the air itself is sometimes bad enough. Well, why contaminate your body with something concentrated?
That's for sure. Well, we have to take a break in discussing all of this.
Oh, you're kidding. Wow.
You need to take a deep breath.
Very good. Well, we'll be right back after this brief commercial message. Welcome back to the third and final segment of It's Your Health. Philip Benyo with my bride.
Why does he say it like that? Exactly. I don't quite know what he means when he says it that way.
It's an enduring term. Take it as it sounds.
Enduring or endearing?
Oh, that's whatever.
Okay. Well, shall we get to our headlines?
Please, save me here.
So get you out of trouble here?
Yes, please.
The first one is one that I'm very familiar with. Rotator cuff injuries. I have dimples, one on each shoulder from rotator cuff surgery that I don't know what I was doing that caused.
Well, it wasn't housework or cooking. Let me think here now.
Never
Maybe
mind.
It was just
The rotator cuff is a group of muscles and tendons that surround the shoulder joint, keeping the head of your upper arm bone firmly within the shallow socket of your shoulder. A rotator cuff injury can cause a dull ache. No, it causes a big pain, which often worsens when you try to sleep on the involved side.
Well, the shoulder is unique because it can rotate, and it does that because there's a cuff in there, and if it's torn, it would have to be repaired. There's certain degrees of rotator cuff tears. It will not necessarily be found on an x-ray. You generally have to get an MRI and see a specialist. But generally with the rotator cuff, you can't go back and touch your other ear or put your arm behind your back because the mechanism that allows that is injured. So shoulder injuries are very common. And usually we see bursitis, tendinitis, which we can sometimes inject. Rotator cuff generally will not respond to that. You might have to have therapy and or surgery.
I tried physical therapy first.
It didn't work, right?
No, he said, go back to your doctor.
Okay.
That was you.
Is that right?
Yes.
Moving right along.
Okay. Nuts in your heart. Eating nuts for heart health. As much as 80% of a nut is fat. Even though most of this fat is healthy fat, it's still a lot of calories. That's why you should eat nuts in moderation. Ideally, use nuts as a substitute for saturated fats, such as those found in meats, eggs, and dairy products. You should have 4 servings of unsalted nuts a week, raw or dry roasted.
Yeah, it has a good fat. Almonds, walnuts, peanuts, all those kind of...
Walnuts is number 1.
Is it really?
Yes,
wow.
it is.
So, yeah, you really ought to include that. It's sort of part of the Mediterranean diet where you're trying to get away from processed foods to more natural ones.
The least fat in nuts is chestnuts, and we don't usually think of chestnuts as a nut. And the most is the delicious macadamia nuts.
Yeah, you like those.
I like those too much. Okay, now we're going to talk, our other headline is about DHEA. You're going to have to tell me what that stands for. And it's touted as an anti-aging therapy to ward off chronic illnesses and improve your physical performance. Is that?
No.
Oh.
It stands for dihydroepiasterone. It's a steroid, okay? And it's probably one of the building blocks of steroid synthesis. And there's no way you can take something like that and stave off the aging process. It just doesn't work. Again, we talk about diet, nutrition, exercise. It's kind of the same theme. For healthy living and picking good parents. I mean, that's kind of key. If you have good parents and good genes, you can work on that and parlay it into longevity.
Well, the NCAA has banned DHEA in athletes.
Right, it's a steroid, so we don't need it, and I'm not so sure you do out there in television land.
The next one is one that I found very interesting. I wanted to make sure it was in with our list of information. California, always at the
Cutting
edge of
edge.
things, yes, whether good or bad, releases cell phone radiation guidelines. Guidelines about cell phone radiation and how to reduce your exposure have been released by the California Department of Public Health.
Well, people don't realize that the cell phone is a microwave. In fact, in the olden days when Dave Thomas and I used to do this show, we actually had a meter that measured the amount of radiation these things give off, and it went into the red line. So you obviously don't want to have a microwave next to your head all the time, which is why we suggest putting it on speakerphone. So yeah, it's a real thing. It's a radiation risk.
And one of the recommendations is not to have it under your pillow when you sleep at night, is to move it away from your bed.
That's.
I just thought, and for New Year's resolutions, I would mention it.
Okay.
And don't carry it in your pocket.
True.
If you have a handbag, put it in your handbag.
Good point.
And when you're done with all of that, you might want to take a nap. Instead of fighting the afternoon slump, give in and take a nap. Catching a few Z's in the middle of the day offers up surprising health benefits.
Sleep is crucial. In fact, there's a very interesting fact out there that maybe you don't know about. Daylight savings time has been associated with at least a 20% change in stroke and heart attack risk. For example, in the spring, when we lose that 1 hour of sleep, there's a 20% increase in stroke and heart attack. Likewise, in the fall, when we get that hour back, there's a 20% decrease in strokes and heart attacks. So sleep is one of these crucial things that we really need to key up on. We do not get enough sleep, and we probably don't get the quality of sleep, which is perhaps why people tend to nap. But nevertheless, I really think you need to reassess your sleep habits, and you'll find that a lot of things will fall into place if you get better quality of sleep.
If you're going to take a nap, find a quiet spot, of course, get comfortable, turn out the lights, and have a cup of coffee. Now that sounds counterintuitive, to have a cup of coffee when you're going to take a nap.
Sure does.
But that caffeine in that coffee will kick in to wake you from your nap.
I see.
So that makes it worth taking. How about that?
We have dogs that lick our face that will wake us up after an hour.
Yeah, that's for sure. That's the least that they do. I have another headline here. Lots of headlines this morning. Chronic heartburn is tied to higher odds for head and neck cancer. Millions of American seniors suffer the discomfort of chronic acid reflux. New research suggests the condition might raise their odds for even more dangerous foes, head and neck cancer.
Right. Well, reflux that is acid coming up into the food tube, can irritate that area, lead to a Barrett's esophagus, and ultimately a cancer of the esophagus. But sometimes lifestyle has something to do with it, because a lot of people with heartburn will ingest alcohol, smoke, and maybe have some bad health habits to begin with. But if you're out there suffering from heartburn, don't just take a pill. And if you're getting symptoms that are refractory to medicine, then you really need to get scoped, get a proper diagnosis and treatment. And speaking of proper diagnosis and treatment, there it is, our...
Oh, we didn't get to the dog.
Sorry, sweetheart. We'll have to save that for next time. We'll save it for next time.
Okay.
Again, thank you for allowing us to come into your home to inform and hopefully entertain you. You're watching It's Your Health, your leader in health care information. Happy New Year.
Happy New Year. Good luck with your resolutions.